Hello, everyone. Thank you for joining us today for the Comprehensive Multiple Sclerosis Nursing Update. My name is Julie Fiel, and I am an MS certified nurse and member of the National MS Society's Healthcare Access Team. Our team works to ensure that people living with MS have access to comprehensive, high-quality healthcare. We achieve this through programs like this one. We're very excited to be partnering with the International Organization of MS Nurses to bring you this comprehensive multiple sclerosis nursing update. I'd like to thank Marie Moore from the IOMSN for her help in planning this program today. Before I introduce our speaker, I'd like to review a few logistics for the webinar. First, I'd like to ask all of you to please mute your lines during the program to reduce any background noise. You can do that if you're on the phone by muting your phone, if you're on a mobile phone or if your phone has a mute feature. If you're joining us through web, there is an option at the top that looks like a microphone. If you click that, it should turn red, and that means you are on mute. We will be taking questions at the end of the program. You may ask your question by unmuting your line, or you may type your question into the chat box if you're joining us by web. You should have received the slides for today's program with your calendar invitation. If you did not get them, please just send me an email and I will get them to you after the webinar. We are recording today's webinar and posting the recording to our website. If you know of anyone who wanted to participate today but was unable to, please let them know. The recording will be available soon. Lastly, if you have any questions after the program, you have my email address. Please feel free to email them to me. I will either answer them or I will get in touch with our speaker from today's program for her to answer. Having said that, I'm thrilled to be introducing our speaker for today's program. Her name is Melanie Huff. Melanie was born and raised in St. Louis and practiced as a combat medic in the U.S. Army. She graduated from Maryville University with her master's in nursing in August 2016. However, she began providing care to multiple sclerosis patients in 2013 as a registered nurse. She joined the MS Center for Innovations in Care at Missouri Baptist Medical Center in January 2016. Melanie specializes in MS and treating the whole patient, including wellness tips and symptom management. She is a member of the International Organization of Multiple Sclerosis Nurses and currently serves as their Midwest liaison. She obtained her multiple sclerosis nursing certification in July 2015. She has 3 boys, ages 19, 16, and 11, 2 dogs, and a cat that keep her very busy outside of work. And all of us in MS nursing know how busy nursing is, so I can't imagine what it's like to have all of those pets and children at home. But Melanie, if you could join us, we're thrilled to have you. Welcome.
Welcome. Hello, everybody. Thank you, Julie. I want to thank Julie and Marie for having me to do this presentation today, and thank you, everyone, for joining. I'm so thrilled to see that so many people are interested in being better educated in MS, and to be able to share the knowledge that I have even learned just over the few years that I have been in MS. It is an ever-changing group of patients and education, and the education never ends, and I truly do enjoy it. So thank you all for coming. Today is going to be a topic about the certification exam. So we're going to talk a little bit about what kind of things the certification exam require, what the requirements are, what the contents may be, but we're not going to cover specific test questions here. And we are going to not obviously guarantee that you can pass the certification exam with this course that you're attending, but to help provide you with knowledge on how to study for the exam and how to prepare for that. So the MS Nurses International Certification Board is endorsed by the concept of voluntary periodic certification by examination for all nurses involved in multiple sclerosis care. The certification in MS nursing is highly valued and provides formal recognition of basic MS nursing knowledge. I think that, as I had mentioned, the MS education arena has always been vast. It always has been a lot of knowledge to help with symptom management of MS patients, but even more so now than ever before. You know, from the progression of our very first disease-modifying therapy approval in 1993, now we have over 14 approved disease-modifying therapies, which you'll see later on, but really requires a special education for that. The candidates available to take the test must be registered nurses, and it is recommended that they have at least 2 years of experience in MS nursing before taking the certification exam. The application fee is $320, and the results are mailed to people about 4 weeks after the testing period ends. There are a few different options for taking the certification exam. One option is by attending the CMSC annual meeting. This year it's in Seattle, Washington. I'm really looking forward to that. The application deadline for the exam is April 29th, and the exam date will be during the conference on May 29th. The CMSC is the consortium of multiple sclerosis centers, and it is a multidisciplinary organization that provides team support and a team approach to MS care. It's a very wonderful educational and networking experience, and it's wonderful to be able to attend that program. It's held once a year in all over cities around America and the United States. The spring testing period will be deadline on May 1st, and the testing begins Saturday on June 1st, and the testing ends on Saturday, June 15th. The fall testing period is deadline is October 9th. The testing begins on Saturday, November 9th, and the testing ends on November 23rd. So as you can see outside of the consortium, there are a couple opportunities per year to take the certification exam, and it gives you a couple week window to be able to coordinate something to schedule that. It is a computerized exam. We're into the 21st century, able to take the exam on the computer. The approximate testing time is about 2.5 hours for this exam. There's 150 questions, and you'll need to answer approximately 110 to 120 of those questions correctly to pass. The questions are multiple choice. Each question has 1 correct answer and 3 distractors. So very similar to all of us nurses out there where we taken the nursing boards and had some distractors in our test answers. And there are no select all that apply questions. In preparing for the exam, it's recommended that people start studying approximately 2 to 3 months prior to taking the exam, and recommending study time is 2 to 3 times per week. Of course, that's just a guideline. I think I started studying quite a bit before that. I was a little bit of an overachiever maybe, but I think that definitely is required. It's not an easy exam to pass, that's for sure. You can't just walk in there without studying and pass this exam. I do think studying is a major requirement. Study buddies are always great. We had 2 nurses. We have 2 full-time nurses in my office, and they both just took their certification exam in the fall and they passed. So I was happy to be able to celebrate that with them, and they worked really hard on that. They did study together, so that study buddy accountability did help too for them. The content area on the exam, this is the outline of the content area and the types of questions that will be asked. So first content will be, one of the contents will be concepts and underlying clinical practice, and that's going to be roughly about 23% of questions asked. The assessment and intervention piece is the largest piece in the exam and will be approximately 42%. The advocacy section is about 10%, education section is 7%, and the research is about 8%. And in the following slides, we'll talk a little bit about each of those content areas and what kind of things are involved in there. So the first one is the concepts underlying clinical practice. and may include the definition of MS, what is the definition of multiple sclerosis, the pathophysiology of multiple sclerosis, the diagnosis, how you make the diagnosis of MS, the McDonald diagnostic criteria, how do you define and diagnose a relapse, and what are the phenotypes or subtypes of MS. The next area was the assessment and intervention for clinical practice. Again, that's the largest area of the exam, and it covers pharmacological interventions, symptoms and symptom management, which we know is very vast and large, psychosocial issues in MS, taking a look at the individual MS patient's environment and the psychosocial issues. What are their physical, emotional, and cognitive health issues? Those sorts of things. It covers assessment tools that we use in everyday practice sometimes for monitoring patients' symptoms, and complementary options, complementary medicine options, and pediatric issues in MS. The advocacy piece discusses patients' rights, ethical practice, how to negotiate the healthcare system for a patient with MS, how to empower a patient and others with MS, how to obtain community resources or what some of those community resources may be, and the organizations out there for MS patients. The education sections covers very specific disease questions, principles of teaching and learning, the health promotion and change theory, comorbidities, which has certainly become much larger topic in MS lately as our MS population is aging because we're becoming, having better therapies for them, developmental issues, culture and gender considerations, and adherence to medications and therapies. The research section covers terminology and process of research, the protection of the human subjects in research, evidence-based practice, how do we use evidence-based practice, why do we use evidence-based practice, translational research, and data collection. There are many study reference tools out there to help someone study for the MS certification. There is a wonderful handbook called the Multiple Sclerosis Nursing International Certification Examination Handbook for Candidates. It's available online, and it provides detailed outline of the topics covered on the exam, and it also includes 10 free sample questions. It's available on the link here on the slide. There's also a wonderful book by June Halper and Colleen Harris called Nursing Practice in MS, a Core Curriculum. And you would want to make sure you have the most up-to-date edition, which is the 4th edition, developed in 2017. It also includes many practice questions and case studies in there. It follows kind of the content outline that we had discussed in MS and is a wonderful tool for studying. There's the MS Coalition Consensus paper, which is a large paper developed on the different disease-modifying therapies in MS, which I think, for most people, I don't know for myself, was certainly probably one of the most, I guess, daunting areas for me to study, just because there now are so many disease-modifying therapies. But this lists all of the drugs, the mechanism of actions, the side effects, and the warnings in the medications. It also lists its effect on relapse rate and disability progression from the clinical trials, so it's a great tool to have. I even use it in clinical practice sometimes as when I'm talking to patients about these different disease-modifying therapies, so I keep it handy. It's available on the link here on the National MS Society page. Looking at the McDonald diagnostic criteria, the new criteria that was developed in 2017, is certainly a good thing to do before the exam, and to know this criteria was changed and allows us to be able to diagnose MS at an even earlier stage now. Additional preparation. There are many different ways you could prepare. Online practice test is available for purchase on the website below. And the good thing about taking a practice test is that it will give you feedback. It will not show you correct answers to your questions, but it will give you feedback on those contents that we talked about, the content outline, and show you where maybe your weak points could be. So for some folks, maybe they have a lower score in the research section or in the advocacy section, for instance. And so it will tell you to focus more on studying in those sections. The Linda Morganti MS Nurse Leadership Program. This is a wonderful course that I was so fortunate to be able to attend in 2015 at the consortium. It's a 2-day course that precedes the consortium. And so people attending the consortium can come 2 days early, possibly attend this program. Now, Linda Morganti, she was one of the founding members of the IOMSN, and she had helped to develop numerous articles and books on the topics of MS nursing. She spoke internationally and extensively in MS nursing, and she was a fantastic leader. So there are scholarships available for this program sometimes, but there's also application that you have to fill out for that. The application is open currently, I believe, until April 1st, and the website here for that is down below. One of the great tracks that you can take at the consortium, so the consortium, like I said, gives many educational opportunities over the course of a few days, and it provides an itinerary that you get to choose and pick which types of classes or things that you want to learn about. And one of the things that they do recommend to help prepare for the exam is taking the Fundamentals of MS class. So this class is actually called a track class because it has, I think, at least 3 or 4 parts to it. So I did take this also the first year I attended the consortium, and it helped me tremendously on the certification exam. You need to be an IOMSN member, of course. It's $50 a year, and there are many online educational opportunities on the IOMSN website and the mscare.org website to help study for the exam as well. There are continuing education opportunities. You can connect with MS liaisons there and ask questions or reach out at any time. So the website has many programs that are available across the nation as well, and it will give you dates and locations for those programs. To stay MS certified, there is recertification requirements. It's required to recertify every 5 years by showing continuing education credits that you have attended over those 5 years, or by retaking the exam every 5 years. And you can look on the msnibc.org website for the specific requirements of those. So facts and questions. How much do we need to know about the disease-modifying therapies? That's a good question. I think thorough understanding of the disease-modifying therapies, including but not limited to, what are the FDA indications for each one of those? What is the mechanism of action? How do we believe that this particular medication works in an MS patient? How does it prevent relapses, disability progression, all of that? How is it administered? Is it injectable? Is it oral? Is it intravenous? What are the side effects like? And what are the risks and safety considerations? The exam questions are they're made for a nurse who's had at least about 2 years of MS nursing experience. So as I said before, the questions do require very careful thought, but reflect baseline knowledge of MS. So you would want to make sure that you have that baseline knowledge and study appropriately. Research and clinical trial information is vast and focuses on many different things, but the MS nurse's role and responsibility in MS research. What does a clinical trial, what are the clinical trial phases? What is a phase 1 trial? What is a phase 2 trial? What is a phase 3 trial? Informed consent, what does that include and why is that important? The IRB, International Review Board, there may be questions on that. There may be questions on the trial design. Was it a double-blinded placebo? Was it a retrospective trial? Evidence-based practice, what do we use in MS? Why is research so important and why do we use evidence-based practice? Symptom management treatments and medications are obviously very, very good to know, and including medications, but also complementary medication or complementary medicine, such as, you know, what do we talk about for different symptoms such as fatigue, sleep, insomnia, you know, numbness and tingling, all of those, spasticity and pain, all of those things are covered in the exam. Here is the full list of the FDA-approved disease-modifying agents at this time. So we have quite a few self-injectable agents, including glatiramer acetate, which is Copaxone and Glatopa. We have the interferon beta-1A, which is Rebif. We have interferon beta-1A intramuscular, which is Avonex. We have interferon beta-1A, which is Betaseron and Extavia. We have a pegylated interferon beta-1A, which is Plegridy. The oral agents available currently are dimethyl fumarate, which is Tecfidera, fingolimod, which is Gilenya, and teriflunomide, which is Aubagio. The intravenous agents available are ocrelizumab, which is Ocrevus, alemtuzumab, which is Lemtrada, mitoxantrone, which is Novantrone, and natalizumab, which is Tysabri. So I think that actually is the last slide in this deck, and we certainly will take any questions that you have. And again, wanted to say thank you so much for attending this program and listening to the different content areas that are on the MS certification exam. And there are many tools. The purpose was this to be able to share and show you all the different tools out there as well for someone studying and looking to take the exam.
Melanie, thank you so much. That was wonderful. While you were speaking, I did mute everyone's line, so I'm going to unmute everyone at this point. If you do have a question, please feel free to speak up, or you could type your questions in the chat box. I'm not hearing any. Oh, I do see. I do see a question. Marie has a question. Will the medications be referenced by their brand or generic names? Excellent question, and that is actually why we include that list at the end. Melanie, did you want to give Marie the answer to that?
Yeah, the medications will be referenced by their generic names on the test. So you do need to know those.
Excellent point. Thank you for reminding us, Marie. Any other questions? I'm just going to give it a minute in case anyone's typing a question. Well, thank you. Randall, who I think goes by Randy, doesn't have a question but is thanking us for the presentation and saying it was very helpful. Thank you so much for joining us.
Yeah, thank you. Glad it was helpful.
I'll give it another minute in case anyone has questions, and then we will close out the program. All right, seeing no questions in the chat box, and it looks like people are muting themselves. So I just want to thank everyone for participating today. I want to give a special thank you to Melanie for presenting, and a special thank you to Marie Moore and the IOMSN for collaborating with us on this program. If you have any questions or would like to send the link to anyone that you know of who was unable to make the call today, please feel free to reach out and email me. I'd like to again put in another plug for the Linda Morganti program that Melanie has already mentioned. It's an excellent opportunity for you to make sure that you have your basic knowledge in MS nursing and feel confident in taking the MS nursing certification exam. So if you are able to attend that program, I highly recommend it. And once again, I'd just like to thank you all for attending today. Thanks so much and enjoy the rest of your day.
Thank you. Have a good day, everybody.
Bye-bye.
Bye.
Thank you.